pregnancy is a beautiful journey. It's a time of growth, new life, and anticipation. But for some women, the path may be more difficult than expected, especially when battling a smoking addiction. If you're pregnant and struggling to quit smoking, remember, you're not alone. Today, we'll guide you through research-based strategies to help you quit smoking for good, because every moment matters. Together, we can break the cycle and give both you and your baby the healthiest start possible. Let's begin by understanding why quitting smoking during pregnancy is so important. Understanding the risks. Smoking during pregnancy poses serious risks for both you and your unborn child. The next risks we are going to discuss now are consequences that seriously affect you and your child. The following 3 risks are caused by smoking during pregnancy. The first one is an increased risk of miscarriage. Research consistently shows that smoking can significantly increase the risk of miscarriage. According to the American College of Obstetricians and Gynecologists, smoking during pregnancy doubles the likelihood of pregnancy loss. The second risk is low birth weight. Babies born to mothers who smoke are more likely to have low birth weight, which can lead to complications such as respiratory issues and developmental delays. The last risk is preterm birth. Smoking can cause premature labor, bringing your baby into the world before they're fully developed. Preterm birth is associated with a range of challenges, from learning disabilities to physical disabilities. Long-term, children exposed to smoking in utero may also be at greater risk for sudden infant death syndrome. These facts can feel overwhelming, but knowledge is empowering. Understanding the risks can motivate you to make the changes necessary for your health and the well-being of your baby. Now that we've discussed the risks, let's move on to practical steps you can take towards quitting. Preparing to quit. Before you quit, preparation is key. Do your research to build a good foundation. Coming up with a plan to quit smoking can make all the difference. Here are some steps to get you started. First is to set a quit date. Choose a quit date within the next 2 weeks and mark it on your calendar. This gives you time to mentally prepare and build your support network. Second is to identify triggers. Pay attention to when you feel the urge to smoke. Is it triggered by stress, social settings, or combined with certain habits like having a coffee? Once you know your triggers, you can create strategies to manage them. Third is to build a support system. Surround yourself with people who support your decision to quit, whether it's friends, family, or a healthcare provider. Their encouragement can be a powerful motivator. There is also research from the Centers for Disease Control and Prevention that found that women who participate in counseling and support groups are 50% more likely to successfully quit smoking during pregnancy. So, don't hesitate to seek out those who can help you stay on track. Let's move on and discuss concrete steps you can take towards your goal with effective quitting strategies. Have a look at some strategies with me. But remember, every journey is different, so what works for one person may not work for another. And these are some evidence-based approaches that could help for you and your baby. The first strategy is to practice nicotine replacement therapy, also known as NRT. Talk to your healthcare provider about safe options like nicotine patches, gum, or lozenges. According to a study conducted by the National Institute for Health and Care Excellence, NRT can help reduce withdrawal symptoms without harming your baby when used under medical supervision. Second is to practice alternative therapies. Many women find acupuncture, hypnosis, or meditation helpful in their quit plans. Studies suggest that these therapies can help reduce stress, a major smoking trigger, while promoting relaxation. Last are healthy distractions. Stay busy with activities like walking, crafting, or gardening. The more you engage in productive tasks, the less time you'll spend focusing on cravings. Nutrition plays a role too. Make sure you're eating well. When you're properly nourished, your mood improves, and you're less likely to reach for a cigarette. Focus on fruits, veggies, and healthy snacks to keep your energy up. The next step is to learn coping with cravings. Cravings are a normal part of quitting, but they don't last forever. Here's how you can manage them when they hit. You can begin with deep breathing. When a craving strikes, pause and take deep breaths. Inhale through your nose, hold, and exhale slowly. This simple exercise can reduce anxiety and give you clarity. Physical activity could be another solution for your craving. Go for a walk or do some light stretching. Physical activity releases endorphins, which improve your mood and reduce the urge to smoke. Last is to remind yourself of the benefits. Visualize your healthy, smoke-free baby. Focus on the positive impact your decision to quit will have on both your lives. Remember, each craving you resist brings you one step closer to a healthier future for you and your baby. Staying motivated. Quitting smoking is a long journey, and staying motivated is key. So please, don't rush it. It's not a race. Behave more like a turtle, slow but steady. A good way to maintain your momentum in quitting is to celebrate milestones. Every smoke-free day is a victory. Whether it's a week, a month, or longer, celebrate each step of your journey. Small rewards, like giving yourself a new book or watching your favorite TV show with some popcorn, can keep you motivated. Another way is to join support groups. There are many online and in-person groups where women share their stories, support each other, and offer practical advice. You don't have to do this alone. Last is to create a vision board. Visualizing your goals can inspire you. Grab a pen and a sheet of paper or your board. Fill it with images of your baby, quotes that inspire you, and reminders of why you're quitting. Now you can look at your vision board when, for instance, a craving comes up. Quitting smoking during pregnancy is one of the most challenging things you'll ever do, but also one of the most rewarding. Each day without a cigarette is a victory for you and your baby. By taking this courageous step, you're giving both of you a brighter, healthier future. We hope this video has empowered you on your journey. Don't forget to like, share, and subscribe. See you later.